herniated disc refers to a problem with one of the rubbery discs that sit between two strong vertebrae. And so these vertebrae hold the disc in between, and sometimes that disc can start to move and shift. When that disc does move or shift, that's because there might be some extra stress being placed on the disc through some sort of movement or some sort of impingement. And if that happens, that can sometimes lead to feeling back pain and even radiating pain. Simple answer is sometimes. Sometimes it can, sometimes it can't. And it really depends again on how significant the herniation is. A smaller herniation can tend to go away on its own. A moderate to a bigger herniation can definitely cause a little bit of extra stress, which may need some outside help. And that's where chiropractic comes in. The short answer is yes. The discs are alive. They're about 70% made of water, and so they can regrow and they can be put back into place. It's not as simple as just kind of poking it back in, but it involves a series of techniques that a chiropractor will use to slowly guide the disc to go back to where it really should be, which is in between the two vertebrae. Now, the techniques that a chiropractor can use will vary. The most common technique is the flexion distraction technique, which is done using the chiropractic table. The chiropractic table will move in a fashion that goes up and down like this at the posterior end where the lower back is. That pumping mechanism of the table will allow the nutrients to flow to the discs, will allow the water and the nutrients to get to the discs, so that way the discs can properly heal. So a lot of times on an MRI, which is the best way to diagnose a herniated disc versus an X-ray, because an X-ray will only look at the bone while an MRI will look at the waterway. And so we'll be able to see the soft tissue through that. But if on an MRI, we look at the vertebrae and the spine and we see that there's less room between the two vertebrae, that means the discs have kind of pushed out. What we want to do is we want to bring the discs back in, and through this flexion distraction and the pumping mechanism of elongating the spine, we're going to be able to do that over a period of time. Now, the timing may vary depending on the severity again of the discs and the exercises and stretches that are given in conjunction with the injury. Well, let's start with the avoiding ones, which will be any sort of high impact exercises. So running, jumping, box jumps, jump rope are usually not indicated for a herniated disc because of the pounding and the high impact of the exercise that will cause more stress at that level. Exercises and stretches that may be more indicated may be low force ones, such as the cat-cow stretch, or it can mean a forward fold, or exercises that really kind of decompress that lower back and take pressure off the disc. A common one we recommend is patients to basically lie on their stomach on a ball, on a fitness ball, which can help to open up the back and open up the disc space to give it a little bit more room. So these are activities that may be indicated, but again, it's all on a case-by-case basis. Fortunately, no. The disc is deep enough where our hands can't necessarily reach, but these exercises and stretches and therapies will help in a more non-direct way. Flexion distraction, chiropractic adjustments, and if the herniated discs are paired with any radiating pain or nerve pain, acupuncture could be very well indicated as well for that injury. Now, treatments for the nerve pain, I mean, it depends on where, again, the nerve pain might be. So a lot of times paired with your herniated disc could be nerve impingement. So the herniated disc, once it gets pushed on and squeezed, it can start to push out along those adjacent nerves, which can start to cause pain down the arms or even down the legs. And nerve pain means that your herniated disc is a little bit more significant and needs a little bit more attention. And so the nerve pinched can present in many different ways. It can be a sharp shooting pain, it can be a numbness, it can be a tingling, it can be muscle weakness or fatigue. If it's a sharp shooting pain, for example, down the leg, that would be called sciatica pain, and that would be the sciatic nerve if it's going down the posterior part of the leg. Sometimes there's a weakness in the leg, and we may test that with muscle testing. Sometimes we may see that the herniated disc is causing numbness down at the feet. In that case, there might be some nerve impingement where the nerve's not getting proper flow, and so that might be needing to get addressed as well at that time. And so we start to add in other therapies such as laser therapy and acupuncture, which are good adjacent or complementary therapies if you have the nerve portion as as part of your herniated disc issue. An L5-S1 herniation means that there's a herniated disc at the lowest part of your back. Now, that can cause impingement of a nerve or a series or a bundle of nerves. Sometimes with an L5-S1 herniation, you're going to see a sciatica impingement or the sciatic nerve being impinged. This can cause sharp shooting pains down the posterior of the leg, which can go all the way down to the foot. Now, there are treatments for this as well. Of course, chiropractic is going to be number one. We want to make sure that we take pressure off the disc through chiropractic manipulations or chiropractic adjustments, spinal adjustments. This will help take pressure off immediately and give you more long-term relief. Of course, we want some of the short-term relief part of it as well through palliative care. This would include figure 4 stretching, lacrosse ball rolling, and foam rolling. And these are more treatments to help alleviate pain while at home. We do have a separate blog that you can definitely take a look at, which are the top 5 sciatica exercises. That would be a great beginning point and to see if we can get some at-home care. Treatment for a herniated disc at C5, C6, that is another big herniation that we see, and that is close to the lowest part of the neck. And that nerve gets impinged. We're going to see pain down the inside of the arm, down all the way into the fingers. Now, that can present in many different ways. It can be sharp pains, it can be tingling, it can be numbness, and that also needs to be addressed along with the herniated disc. Again, the number one treatment for the herniated disc at the C5, C6 is going to be chiropractic care. We want to immediately take pressure off of the disc, off of the nerve. Secondary would be using massage techniques down into the arm, using ART or active release technique to release the muscles that follow that nerve all the way down into the arm. And finally, laser therapy can really help immediately reduce inflammation at the nerve level and give you instantaneous relief. Herniated disc and bulging discs are very synonymous, so the treatment would be very similar for a bulging disc, which is chiropractic care, possibly acupuncture and laser therapy, along with that if there's any sort of nerve impingement with that bulging disc.